Okay, ready to roll. Guys, today's live session, I'm going to kick it off talking about why sitting eases your sciatica quickly for many people. Why this action of just taking the weight off your legs starts to ease that sciatica immediately. And it runs counter to a lot of what we talk about. And hopefully if you guys can understand precisely why you find sitting eases the symptoms of sciatica, or maybe those symptoms of back pain where you feel like you're taking pressure off, then you can understand why this is a particularly difficult trap to fall into. And if we start out with why or what is happening at the root cause of the sciatica first and foremost, because there's a lot of confusion around this. And make no mistake, sciatica is caused by an injury to the spinal joints in the lower part of the lumbar spine. It's not your piriformis, it's not some weird other and wonderful thing. It is an injury down here to L4-5, which is this one, and L5-S1, which is this last one between the green and the orange, that is irritating the nerve roots. These little nerve roots go on somewhere around about here where my finger is pointing to form the sciatic nerve. That is what is causing your sciatica. Now, there might be comments about degenerative disc disease. There might be comments about stenosis, maybe spondylolisthesis, maybe herniated discs, maybe other things as well, right? But that's the issue. An injury down here is causing symptoms down the leg. And when we have these injuries, a lot of times people will notice that their back pain or their sciatica is particularly bad first thing in the morning. And this kind of feeds into why sitting can often make it feel better. And that is because you've been still all night, yet the injured tissues are inflamed. They are injured and they are creating congestion in this region. Now, unlike other peripheral joints, you might wake up in the morning and notice your knee is a little bit swollen. You might wake up in the morning and notice your wrist or ankle is a little bit swollen. In the cases of the lumbar spine, when they are a little bit swollen, we have swelling specifically in this area, which is very different to other areas of the body, in so much that it is a bony tube that the nerves and the other tissues around that inflammation are rolling through. And so you feel that stiffness, sensitivity, that soreness. You get out of bed, you take one step, and all of a sudden it's jolting straight down your leg because of the position of your spine in that moment. And what does sitting offer? Sitting, when we sit down, if we take the spine, if we look closely at these segments up here, I'm talking about down here, but you can see this segment up here and here a little bit more effectively. When we go from a standing position like so, and then we go into a sitting position, you can see they get larger. And so this is often what eases that symptom more or less instantly, in that when they sit down, they posteriorly tilt the pelvis, it opens out the holes where the nerves come out, and then they feel better. Someone said here, I'm the opposite. I get pain when I'm walking and standing. People with things like spondylolisthesis, which is where one vertebra slips forwards on the other, will often find that walking creates pain, and then when they're walking, and then they find that, oh, if I just squat down like this, just stay here for a few moments, it eases the pain, and then I can come up and I can carry on walking for a bit longer, and then boom, it becomes painful again. I won't get off topic with addressing that, but I might come back to it a little bit later. There's a reason for that, right? But the action of sitting, the reason that feels better is just because you're changing the space of the holes. But there's a consequence to that. What we're doing is putting flexion, and you'll be tempted to round the lower back even more to create that feeling of ease. This is the same reason why your knee hugs in your child's pose, hugging the knees, why they often feel good in the moment. And that is because they are opening out that hole. The problem is that is generally not the root cause of the problem. That is a symptom that we're addressing. The root cause of the problem is that the loss of ligament integrity at that level. The ligaments have been injured. And those ligaments include the ligaments of the disc. We can see in the herniation, the annulus fibrosus. This is going to have been damaged. In the process of this being damaged, you're going to have ligament damage. In the process of the spondylolisthesis, you're going to have ligament damage as this one vertebra slides forwards. Your back injuries are fundamentally injuries to the ligaments that stabilize the segment. And so you going and doing that all the time is only making the problem worse. And so when you sit down, you crank through the area like so, and you just sit there because it's relieving and you don't want to stand up again because it hurts. You're just allowing this issue to get worse and worse and worse. And then what you find is this self-fulfilling prophecy. Because the hole's larger, more inflammation can fill up in this space before you start to get symptoms. And maybe you don't actually get symptoms. It's only when you go to get up to get out of the chair that you straighten your spine back up to the right position, and boom, that shooting pain sciatica down the back of the leg comes back on again, and you think standing is the problem. In this case, no. We're doing a very bad job in this scenario of managing the inflammation that's down in this area of the lumbar spine. And whenever we're changing the shape and size of that hole, moving in one direction or another, standing up from sitting down, putting it back to its normal size, we are creating opportunities to pinch and aggravate those roots of the sciatic nerve and not quite understanding the full problem. We've got an injury at the root cause of the lumbar spine, which is creating inflammation, filling these holes where the nerves come out. There might well be some other things like bits of disc bulge that are also filling those holes. And by changing the size of that hole, changes the pressure. And if there's nerves in there that are a little bit sensitized because of the injury that we've had for maybe a duration of time, it's going to re-aggravate and provoke those symptoms. And so it's particularly bad for those of you that find sitting is relieving, because in the process of getting that relief, you're actually making the problem worse. It's much, much better, I would argue, prognosis-wise, if you're someone that finds sitting is actually painful, because it stops you doing something that's bad for you, something that's bad for the underlying injury. And that's one of the complexities around back pain. Unfortunately, because of the way in which inflammation can build up in these confined spaces, it's all too easy for us to focus on the pressure in the space at the expense of the underlying injury. And so that's something to really start to consider a little bit more. Now, if we want to sit down and take a little bit of pressure off, one of the strategies to work around this is that we can sit in a somewhat reclined position. Now, obviously, with me putting my legs up here, it's not going to work so well, but let's just suppose you had a good chair that had an extending leg. If you recline in this sort of position, now I don't have as much load on my lumbar spine. I can put a little towel behind my back here and support the neutral spine, and this actually is putting less pressure on my spine than the sitting. So we've got standing that puts an amount of load through the spine. Then we've got sitting, normally, which increases the load on the lower lumbar spine, L4-5 and L5-S1, by around about 40 to 90%, depending on how bad you're sitting. And then we've got a reclined position, maybe without the legs being out, right? So like this would be sufficient. And this decreases the load that was on my spine in the standing. So this is kind of like a halfway house between lying down and standing up in terms of the load. The problem with this is that although my spine might be in neutral because I've got a bit of support underneath my spine, I've got less pressure on the discs, which is great. When I go to get up, I have to be mindful, right? If I just go straight out like so, that's a lot of spinal movement. And this is one of the reasons why education and practice with the exercises is so important early on. Because if you're starting to learn about a neutral spine, how to maintain it, how to transition from one position to another, with this in mind, you will drastically reduce the number of flare-ups that you're having of your back pain on a moment-to-moment basis throughout the day. The biggest reason you guys don't get better and struggle for months, if not longer, with injury to the lumbar spine is because you're unwittingly messing things up each time. We're getting out of chairs like I just demonstrated. Oh, let's go like this. And these little things just mess you up over and over again, little unnecessary aggravations, and we don't know why. But when we are educated and we start to understand these things and that we're constantly moving the spine all over the shop, we realize that it's because we keep on abusing this section of the lumbar spine. I'm not saying it's intentional, far from it. Once you know this, you become a lot more aware of how to look after the spine more effectively. However, just the acknowledgement that there are so many ways in which we are flaring ourselves up. And if you take a step back and you think about, like, when did my flare-ups happen? My flare-ups didn't happen when I was still. I flared my sciatica up when I went to reach for something. And this is the biggest misnomer. Everyone's talking about so frequently about, oh, you've got to move the spine. Its spine's supposed to move. Yes, it is, but not when it's injured. You can't control the segmental movement of sections of the lumbar spine. You can only brace it or allow it to move freely. It's your choice. Which one do you want, right? And if you've got an injury, you guys are flaring yourself up when you are moving from a static position to another position, meaning movement went through the spine and strained the tissues, not lack of movement. You didn't stabilize it as you went to move. You didn't learn that actually, instead of getting out of the chair like this every time, and having your spine move all over the shop, you can just brace yourself and come straight up like so. Significantly less provoking of the lower lumbar spine. which means this is one of the reasons that so many people notice that they get significant improvement in a relatively short period of time. Not fix the spine, right? Very important. It's not fixed, but they get significant improvements in their symptoms just by the simple fact of stopping aggravating them unnecessarily with a little bit of education. And then comes the hard work to actually rebuild and strengthen the spine itself. What else have we got here? We've got some questions coming in. I'll go through some of those because there's quite a few of you on TikTok. So hopefully this will help you guys. And those of you on YouTube, guys, if you've got questions, post them in the chat. Okay, where are we? So Melsa said, I have osteoporosis in my spine spreading to my legs when I'm on my knees. It triggers my back. Not too sure what we're saying there, to be completely honest, Melsa. Slayer has said lower back tightness. Guys, most of the time, your initial symptoms will manifest as back tightness, stiffness. And then that gets diagnosed as muscle spasm. And then you go stretching the muscles and you make it worse and it doesn't seem to be getting better. And then, you know, many of you guys in the comments will probably be able to attest to this, that you got misdiagnosed as muscle spasm in the back for like 6 months to 18 months. And then you finally had the MRI and, oh yeah, there's actually something going on that we could talk about. Do you have any exercises to share to improve L5 herniation? Courtney, that is exactly what we do in the program. That is exactly what we do. So we break it down, right? You've got 3 aspects to recovering. More or less 90 to 95% of the members of the program and patients we see here in the clinic will have injuries to, such as herniations, bulges, etc., to L5S1 and L4-5 at the level of the lower lumbar spine. It's where more or less everything is there. And the rehab that we talk about is as follows. We have 3 parts, the first being relief-based work. We touched on this a couple of sessions ago on the lives to explain there are 3 different kinds of relief work, but we'll focus on just relief work generally for this answer here. Relief work is stuff that takes pressure off the herniation in one way, shape or form. You do this multiple times a day. It could be the towel decompression using a rolled up towel placed underneath the lower back to support the natural curve, take pressure off the ligaments, off the muscles and off the spine itself. It could be the bed decompression. It could be some simple but effective lower body stretching of the hip musculature, not rounding your lower back. It could be using contrast bathing. These are relief-based strategies that help relieve the stress and strain on that herniated disc down in the lower lumbar spine. That is temporary. It is not long-lasting because you're living life every day with this lower back and you're going to continue to put strain on it. The second part, which is the stuff that actually gets you better, is the rehab. That is the strengthening work. That is building strength and resilience into your lumbar spine. We talk about the core 5 or now core 6 in the program. We've got things like the dead bug marching bridge squat, hip hinge and step up, and the single leg hip hinge. These are fundamental exercises that we take everybody through in the program that are used to rebuild spinal health and strength. And Patrick has said in here, I have a laminectomy at L3, 4, 5. Listen up closely because this is exactly what you would be in that category as well, right? People that have things like microdiscectomies, laminectomies, discectomies, and other spinal surgeries. This kind of rehab is all about providing stability to that area of the lumbar spine. So those kind of exercises that I mentioned. You're always operating under the guise or the proviso that your exercises are aggravation-free with correct choreography, meaning you're not aggravating the symptoms, however minor they are. If you start the squat with a baseline level of 2 out of 10 pain or 3 out of 10 pain, and you go into the squatting motion and then you come back up again and that's all you do, you got no aggravation, that's great, right? But if you're going down into the squat and then you go, oh gosh, that hurts a lot, we come back up and we go, right, what did we do wrong? Whenever you guys are doing your exercises, ask yourself the question, especially if you're struggling. Those of you like Patrick who've had a laminectomy, or the other earlier question about the herniation L5S1. How many times have you recorded yourself doing your exercises, watched and studied a tutorial video, and then compared what you should be doing to make sure that you are doing them without aggravation? These are important principles that we talk to our members through in the program. And then there is the education. That's why we do these lives, right? To help educate, help you guys understand a little bit more about the back. Because the back injuries are very different to injuries in other areas of the body, in so much that you have to look after your back every single day. When you go and have treatments for a significantly sprained ankle, a broken leg, meniscus strain, or something like that in the knee, you might well get the joint at the, in the more severe scenarios, you might well get it put in a cast or a boot or something like that, or a sling if it's the arm, to stop you messing it up. It might be that you've just been given some crutches. It might be that you've just been given guidance to take pressure off that leg a little bit and use a walking stick for a short while, so that we're not putting as much strain on that section of the limb. With your spine, you can't do this. You are sent home with your spine continually putting strain through it every single day. Conqueror, these are the exercises for L5-S1. Everything I'm talking about right now, it's for the lower lumbar spine or the lumbar spine in general, right? You guys have to realize that there are no different strengthening exercises for L2-3, L3-4, L4-5 or L5-S1 or the SIJs, because all you can do is strengthen this area. You cannot strengthen one joint preferentially over another, fundamentally, right? People have a hard, this is where the rehab needs to meet the individual, where they're actually skilled, right? People have a hard enough time doing effective rehab, right? Let's just use the example of the dead bug. Many of you guys might have tried the dead bug before. It's where we're engaging the core to provide stability to the midsection so that we can challenge it in an effective low gravity environment, right? I'm on the floor. So I'm down here, I'm doing my dead bug, right? And I go out with the legs, we put the hands here, we don't mess around with the arms up here, right? And I'm coming back in. If you can't do the dead bug without getting aggravation of your symptoms, no matter which one of those exact segments on the left or on the right that you have, you're not even able to control your spine when your leg is moving, right? You can't even control the whole spine when your leg is moving. What makes us think we are capable of being specific enough to affect the L3-4 disc bulge on the left-hand side that's 3 mil? That's not where rehab comes in. That specificity, this is not something that's taught. The specificity of that kind of nuance that I just mentioned is for the surgeon that needs to operate on something. For you guys with the rehab, if you have a lower lumbar spine issue, which is where 90% of them lie, when you do your rehab, you are stabilizing the SIJs, you're stabilizing the lumbar spine, you're stabilizing up into the thoracic spine, arguably, and you're providing a bracing support for the spine as you're moving through these exercises. That is what you are learning, and that is what you struggle to do to start with, and that is what you build through the rehabilitative process. And so you guys coming in say L5-S1, L4-5, that is what you need to do. Exercises, just to repeat for those of you that haven't jumped in yet, or have only just jumped in. Exercises like the squat, the hip hinge, the step up, dead bug, the marching bridge. These are exercises, and the great thing about these kind of exercises, for those of you with sciatica, with lower back injuries, is that they're a test, meaning you test them. If you can't do them without pain, that's an indication that we're not very good at them. And so we try easier versions. We maybe try it again, right? The first time you tried it, you didn't know quite what you were doing. You go back and revisit, and then you try again, right? But you might need to do an easier version. You might need to hold on to someone's hands when you're doing a squat, etc. So they're the test, they're the starting point, and then they actually drive progress, right? So you steadily progress doing the squat. You do it in harder and harder variations, maybe with load as you progress on. And then you reuse that same exercise as a reevaluation. You go, I couldn't squat or I couldn't do a dead bug for more than like 2 or 3 reps 6 weeks ago. And now I'm doing 10 reps, I'm doing 5 sets, I'm doing, maybe on the squat, I'm doing 10 kilos, right? And that is a measure of progress. Whereas if we compare it to the exercises that so often people are doing, we're doing like, silly little exercises, hugging the knees, bending backwards, bending forwards. Like, how many reps of those indicate I'm better or not? And how better am I, right? You don't have any of that information from those kind of exercises. Whereas if we're doing things like a squat, a loaded squat, obviously no load to start with, and then we build load in, we have a very clear measure. It's not foolproof, but it's the best measure you can have of how healed your spine currently is. Whether it's post-operation, whether it's post the herniation, whether it's just that you've been struggling with back pain and sciatica with no specific formalized diagnosis for an extended period of time and you haven't been able to do what you want to do. You start to realize that actually if you can only pick up 5 kilos, you having to pick your toddler up who weighs 15 and put them in the car while they're wiggling is probably not the best thing for your back. Now you at least appreciate why that's not a good thing. And it makes more sense because there's nothing worse than thinking that there's something wrong with you and there's no apparent reason why you should be struggling so much. And this is where education comes in. It helps you start to appreciate that actually there are lots of little things that are aggravating my back every single day, and I'm not strong enough to deal with those things, but I can be stronger. And the great thing about that is that no one can do it for you. You are the only one that can do it, which is good. People can help you, obviously, but something to bear in mind. Questions on here? You've got quite a few. Guys, I'll try and keep up with them as best I can. Can I still do the exercises when I'm in a lot of pain? That's a very good question, Cynthia. So exercises, a definition. I'm gonna butcher this a little bit, but hopefully you guys get the general gist. If you go into Google or the Oxford Dictionary and look at the definition of exercise, it's something like a physically strenuous activity that's geared towards a health outcome, right? I'm sure Cynthia and others, those guys of you that are struggling with your back pain, you can look at many things that you have done this morning and will do this afternoon that are physically strenuous. You look at someone when they come into the clinic, it's physically strenuous sometimes, right? They're just walking. They're just getting dressed in the morning. They're going to the bathroom. They're getting out of bed. They're making coffee. Those are all physically strenuous. But you know what they have? Zero benefit for your recovery, your strength and resilience. Admittedly, we have to do them anyway, right? They're just part of daily life. So if you're willing to do that with the pain, why would you not be willing to do something that looks like this? Holding onto the door frame maybe, right? And going. And then going back and watching a tutorial video, checking you did it, and then looking at the recording that you just did of yourself to check you're doing it correctly. Why do I make it seem so silly? Because some of you guys are going to need to start at something very, very simple, right? And that's why the exercises should always be aggravation-free reps. You don't push through the aggravation. And the reason that I say aggravation rather than pain is because some of you will inadvertently be pushing through symptoms that aren't quote-unquote painful, but they are being aggravated, right? Some of you might have pain, but then you've got this numbness and tingling, and it doesn't really bother you as much as the pain, but it gets worse when you do some of the exercises. So you kind of say, well, it's not painful, so I'll carry on. It's like, no, you have symptoms that are associated with your back injury down here. Some of them might be pain, some of them might be numbness, tingling, etc. You do not aggravate those whilst you're doing the exercises. And if you are finding that they are being aggravated during the exercises, there will be a specific point in the exercises that they became notably worse. And you need to pay attention to that. And that can sometimes take a little bit of work to figure out where exactly that is. And we're working blind if we're not recording ourselves. You guys all have smartphones. Every one of you guys on TikTok certainly are on a smartphone. You should be recording yourself when you're doing these things so that you can start to understand this. And if we're in pain, often that's actually a bit of an asset, to be completely honest, right? Because if you're in pain, you're a little bit more sensitive. The people that actually struggle with the exercises the most, or have the most risk, let's say, are actually those that are a bit chronic, particularly guys, I would argue, right? Because it's all too tempting for them to kind of push through. Because they're not that sensitive at the moment, but it's just chronic, they kind of push on through. And it's only when they get to a higher level of strain, using maybe weights when they're doing a squat, that they actually start to become into a little bit of trouble, right? Because the technique wasn't actually refined. That's why I said earlier on, your exercises to recover from these lower back injuries, the sciatica, the herniated discs, should be aggravation-free compared to the baseline, which is how you went into the exercises that day, how you're feeling that day. And they should be with correct choreography, correct technique. And if you stick to those principles and move forwards from there, you will find things start to improve relatively quickly, even in the cases of having it for a long period of time. Just looking through some more of the comments here. Olivia, I have bilateral pars defects at R5. I suspect potentially up to a decade. Do you see this much? I wouldn't say much. Like it's not the most common, but we have a good number of members and patients over the years that have spondylolisthesis with no plausible understanding a spondylolisthesis, whereby there's a detachment of the front part of the vertebra and it's slipped forwards, and you can see the back part of the vertebra on the X-ray, on the imaging, right, is still here, and the front part is sliding forwards, grade 1, grade 2, etc. Right? You tend not to see grade 3, grade 4 as frequently in our kind of clinical practice. You will obviously in a hospital setting, but being an osteopath, seeing people walking into the clinic, you tend not to see that as much. Although I've mentioned a number of times on the lives a case very early on of a grade 4 spondylolisthesis walking in with some backache that was just getting checked up. Anyway, I digress. You do see it more often than you were led to believe at university you would come into contact with those kind of things. And I think the most important thing to acknowledge in those sorts of scenarios, Olivia, is that you've got the pars defect and then you've got the spondylolisthesis, right? You might not have the forward slippage, but you might have the pars defect noted. And that's cool, that's fine. Being aware of that before you have the slippage is actually really, really helpful. And the answer here is there is some kind of, how should we put it? Lack of optimal, that is a massive spider up there. Lack of optimal structure in the lower lumbar spine. And so the most important thing you can do for the long term, and I say this to a lot of the patients with spondylolisthesis and members with spondylolisthesis specifically, whatever grade it is, it doesn't matter. Same thing's true. It's just to the degree it's a more severe grade. I would also put those of you that have had surgery or particularly severe herniations in this bucket, by the way, is that to the degree you've got these abnormalities, if you will, or less than optimal spinal features, you must build greater load tolerance than the average, slowly over a long period of months to years, for the future, indefinitely. And then greater than average hip mobility. And if you can do that well, the reason for that is that when you're building load tolerance with a neutral spine, you are acknowledging that you are protecting this area from vulnerable movements provoking a weak point, because you cannot control L5S1 or L4-5 specifically. You can only control the lumbar spine. And you're leveraging the hips so that the movement that the lumbar spine is going to be involved in, think about them. You never do lumbar flexion. You do picking something up off the floor. You do getting into the car. You do X, Y, Z, right? Tying up your shoelaces. All of these are compound movements. We separate them out maybe for the purposes of training, but this is why we use compound movements in the program, because they're true to life. And so to the degree your hips are strong and a little bit more mobile, they will partake in more of the movement that you're doing before your lumbar spine has to. And so combining that with a good appreciation or a greater than average appreciation for the neutral spine and your ability to maintain it, stillness within the lumbar spine in spite of what's happening in the outside world, then you're going to create a greater degree of resilience, because it's less likely that you're going to put that spine into, can't do it with that one, into some kind of crazy position like so with a ton of weight going through it. You're just less likely to do that. So you develop good habits. You develop good ways of doing certain movements, such as the ordinary activities of daily living. And that's what will keep you well for the long term. So hopefully that makes sense. And thank you for the question. Byron has said, how to stop a flare-up at night, waking up every hour in pain. I'm afraid to say we get a lot of questions about waking up at night with pain. And I think most frequently, you roll over, ouch, that hurt, you roll over, ouch, that hurt. Maybe you're a restless sleeper anyway, and now you've got an aggravation in your lower back. It wakes you up a little bit more frequently, right? I can understand that. But the time of day that we focus on fixing that issue is during the day. It's hard enough to get people to do the day with 100%, let's say 100% success. You're cutting corners here, cutting corners there, because you have to, you're living life, right? And then we expect to have success when we're unconscious. Focus on the parts of the day that you are conscious. Do everything right then. Make sure you're doing your rehab. Do your relief work. If you've got relief work, the core relief work that we talk about in the program, your towel decompression, your lower body stretching. Be conscientious about how you're using your body. Make sure you're getting your rehabilitation strengthening work done. And then obviously giving yourself time to progress with that, because results don't happen overnight, right? You're trying to heal something. When we have a cut on the surface of our skin, we quite clearly know that cut isn't going to heal. I've got a new one just here, scratched at jiu-jitsu. I know that's not going to heal overnight. It's probably a little bit sore. That's probably from Friday, actually, right? It's still a little bit red, a little bit inflamed, a little bit sensitive if I tap it. Over the next week or so, that's going to be less sensitive, but it's still going to be there. And just because it's not painful doesn't mean I can't knock the scab off again. The same thing is true in your lower backs, although those tissues are much more slow at going through that healing process. And so you've got to focus on trying to win the day. Yes, okay, we can try and position our spine. Side lying tends to be better when you're sleeping. Having a pillow here for ladies, because it stops your pelvis rocking the spine one way or another. Having a pillow between the knees. Making sure you're neutral, not curled up like a ball. Those kind of things can help. But really the reason we're so sore at night is because inflammation is then building up, because we haven't done things right during the day. That's the important takeaway there. What else have we got here? Butters has said, I can't squat without going on my toes, which makes me unstable lifting, and I don't want to hurt my back more. That tells me we are not actually going about the strengthening process correctly, right? Because the squat, you shouldn't be going up on your toes. Right? So we're going to a point where there is a point where you go up your toes. You didn't, and this is, the specificity really does matter. When you did the squats, you didn't go up on your toes and then start doing a squat, did you? You did a squat and then had to go up on your toes. And so that's a very important point of distinction. So you need to spend some time, I'll stand on the platform, actually doing a squat where you don't go up on your toes, figuring out when you're about to go up on your toes, and then not doing that, right? To get good squat technique. That's why it requires some time to actually work with, for example, tutorials and recording yourself and reflecting on these things to get the correct technique down. Whether you've got back pain or not, you should be approaching this in the gym with all of your exercises to make sure you're actually technically competent and not just going to cause yourself all kinds of trouble. So very, very important that we go around doing this in the correct sort of manner. Now, to take a slight tangent there, what we do say to people, for example, if you can only competently squat maybe holding onto a door frame or even just free weights, you can only go to here before you start rounding your back or going up on your toes, because this lot is all weak and not very coordinated. Then we have a problem, because if you happen to drop your phone on the floor, well, now all of a sudden you can't pick it up, right? You can't pick it up. So you have to do something to get down there. And so in this sort of scenario, yeah, sure, holding onto something and going up on the toes helps me put my spine under less strain. But it comes at a cost. I need to rely on these knees to be able to do that, these ankles to be able to do that. Otherwise, if I'm doing that for too long, I'm going to start to get in some trouble. Now, I mentioned to you guys a little while ago, this is why, unfortunately, a lot of you guys, you injure your lower back, it's kind of a repetitive strain injury. You didn't do anything crazy. You didn't. It wasn't like you were doing a personal best on your deadlift with 150 kilos and all of a sudden you went a bit too far. Most of the time, I was picking up my water bottle. I was picking up my trainers. It kind of just seemed to get a bit worse. That's the kind of scenario that you guys have. And unfortunately, we're just not very strong. And so you don't have the capacity when you injure your back to use other areas like the knees and the legs to compensate. I mentioned a couple of months ago, I injured my knee, meniscus tear on both the medial and lateral meniscus. For a short period of time, because I literally could not get out of a chair with load on this leg, I was doing two things. Number one, well, I could just get out on one leg, right? Because I've got a strong leg, because my other leg was strong, right? But also, I was using my back a lot more for doing stuff because I couldn't bend my knees as easily, right? So my back took some abuse for a short period of time. But because I was dealing with the rehab for my knee and using a bunch of the laser as well and other bits and pieces, right? Just because I'm lucky to be able to do that, I could fix the knee quickly, so my back had abuse for a very short period of time. Unfortunately, so many people get an injury to a vulnerable structure and they just don't have the support. They don't have other muscles, other joints that are actually strong and healthy. Everything was hanging on by a thread, and when we injured the back, boom, now we're in trouble. A lot of times I would argue that if we take a step back, especially I would say in the age group that maybe somewhere between 40 and 60, like it's actually, do you know what, I actually injured my knee. And then, after 6 weeks, my back started to bother me, and my knee is not necessarily bothering me so much now, but my back's just been worse and worse and worse and worse and worse. And it was actually the knee injury, maybe, or the ankle that preceded a then significant back problem. So something to think about there. Leo said, what are your thoughts on deficit deadlifts? I actually do a small deficit when I do the deadlifts here, because I put a piece of wood down. It just makes the rubber matting is a little bit less good. I think for the average person, deficit deadlifts are probably not necessary at all. They're just not. I think for some, so let me rephrase this. What should you do first? I think a deficit hip hinge would make sense for a certain group of the population where they are more mobile and want to improve their mobility further. Because maybe they're, certain height, that kind of stuff might mean that they have very, very good levels of hip mobility in the hamstring specifically, and allow them to go low, and they just don't feel like they're able to get to the bottom of the rep before they hit the ground, right? That might make sense in that scenario, but the caveat needs to be, once you're at a pretty good range of motion on the squat and the hip hinge, specifically speaking, most people have let's just say a 25 to 50% room for improvement on the actual range of motion, but they've got a 3, 4, 5x room for improvement on the loading. And so for most people, I think the concept of any kind of deficit movements, which is basically where instead of doing the deadlift from the floor, do it from an elevated platform so we can go even lower, I think that's just something for advanced training for someone who's not got a back issue. I think that, and then some people will have certain opinions of those kind of things. I think fundamentally deficit deadlifts, I think, are maybe a little bit unnecessary. I can see the merit more so in maybe a deficit hip hinge or Romanian deadlift. That might be worthwhile, but I think we have to ask the question, how much time do we realistically have to be training? And for most people, unless you're particularly enthusiastic about training for training's sake, which there are many people that are in that category. They just enjoy doing that. They go to the gym an hour and a half a day, and they want to do that for the long term. But most people don't fit that. They've got to make it fit in around work, lifestyle, family, other half, all that kind of stuff. I think deficits are something to add in if you're able to do spend a ton of time in the gym, quite frankly. So definitely not one for anyone with a back injury to be worrying about for the foreseeable future. Tommy has said, should you do hip hinges and dead bugs? Probably every day or like 4 times a week. So when you are starting rehabilitation work, and this is probably very relevant, Fireboy Nub, to your question about giving you steps to recover from an L3, 4, 5 disc bulge. When you are starting exercises, rehabilitative exercises, so such as the hip hinge, such as the dead bug, you're probably practicing those daily. So members that come through the program and do core phase 1, which is the first phase, they are doing those exercises every day, right? Very quickly, we turn that in a live routine, right? And when you're starting, before you even get to doing a full routine, you're probably playing around with the individual exercises a couple times a day to try and figure out how to do them correctly from a technical standpoint. But then as you progress on, and just for reference, hip hinge, right, is a hinge from the hips, right? That's a hip hinge, okay? It's not a squat. So we're just bending about the hips. It's just doing this. Hip, hinge. No spinal flexion, okay? So very important. So when you're starting out, you're doing the exercise daily because much of the benefit in the early instance is going to be from the technical standpoint. You're improving the technique of doing that movement. And then you might start playing around with weights. You pick up some very nominal weights, maybe in something like a water bottle, and you do exactly the same movements for the squat, hip hinge, and step up, for example, adding a little bit of load just to make sure you've got the choreography there, right? And then from there, you then start building the intensity. So this is what we would talk about in our phase 3 and phase 4 workouts. And again, is a hip hinge suitable for? Yes. These exercises that we talk about are for our members and for our patients that come here to the clinic, of which 90 to 95% have some kind of disc-related injury, be it a herniation, a bulge, they've had a surgery, they've had a microdiscectomy, they've had whatever it is, at the L4-5 and L5-S1 segment of the lumbar spine, here to here and here to here. And then often there's going to be, maybe there's a little bit of L3-4, there might be some other areas, maybe the SIJs are involved a little bit, but that's the epicenter for most of where the injuries are. And these are the exercises that we take them through. And so as you progress on with those exercises, over time, the demand, you may be using a barbell, maybe using kettlebells, heavier ones, okay? You necessarily need more time to recover. In the early days, much of the benefit is technique. You're improving your technique. You're not actually getting stronger. You're getting better at applying the strength that you do have to the movement. You're more consistent at it. Less errors, less movement failures or movement leaks. And then as we actually start to find the right intensity with the right amount of load, then yes, we start making some muscular change. But then the key is the long term, we're actually putting load through the spine of significant enough magnitude to get change within the segment itself. These load-bearing structures, the discs in particular, are actually getting stronger again. They're improving in their strength and resilience, responding to the strain that you are putting through. That is proper rehabilitation. Rehabilitation isn't just healing. It's actually going through that healing process and then strengthening the tissues up again. Make no mistake, if you've had a back injury for a long period of time, it might be explicitly to L4-5, or it might be explicit to L5-S1, but it will certainly have affected the strength, the health, and the resilience of everything from here down, and arguably everywhere else as well. You're probably less active, so your cardiovascular system isn't as fit as it was before. And if your cardiovascular system isn't as fit, your lungs probably aren't quite as good, your heart's probably not quite as good, your upper body's a little bit weaker than it was because you just haven't used it. A great example, many of you will be able to relate to this, right? The body is going to respond to what you put through it. I used to deadlift 230-ish kilos, just a little bit over. I cannot do that now because I have not trained to that level in that particular way because it requires something that I'm not as interested in, building that kind of level of strength. But having done a meniscus injury to the medial lateral meniscus of my knee back at the end of June, I did my squats earlier today and I'm doing 10 reps of 90 kilos again, pretty easily, without too much trouble, right? And being careful, obviously getting back into it. Like there's that baseline level of strength that's there, but I'm not as strong as I was before because my body has broken down the adaptation that it had to do the 230 years ago, and I'm not conditioned to do that. It's an important point. Where rehabilitation, where healing stops and strengthening starts, is really a matter of semantics. Like when is it actually stopping? Because it's really getting stronger from day one. Especially in these load-bearing structures, we're looking to rebuild resilience and maybe even, I would argue, in a lot of cases, for a lot of people that have a back injury, build up a degree of resilience and strength in their spine and surrounding muscles, joints, and tissues that they have probably never had before. Because lots of people don't do this, right? That's self-evident by the prolific nature of things like diabetes and obesity. Most people don't do these things to a significant level. And so there's a lot of room left on the table to make some significant improvements, even after an injury. And on the topic here, I'm not going to butcher the name, I apologize, but it said approximately how long will it take to move from phase 1 to phase 2? That is hugely variable from one individual to the next. It depends on your current baseline level of skill more than anything else, as well as your personal approach of diligence to actually doing and executing this in a sincere manner. And for those of you guys that need help with this, if you've been struggling for a long period of time, I haven't mentioned it on the live stream yet, go up, if you're on TikTok, go up to the link in the profile page. If you're on YouTube, I'll post it in the chat. And if you're watching this after the fact, it'll be in the pinned comment. Check out the link over on that website, backinshapeprogram.com/start. Link over there, link in the YouTube chat. And watch the video there that explains a little bit more about the program. If you have been struggling for a long period of time, I would strongly suggest having a look at that, because that gives you the structure, the support, the education, the guidance, the strategy, the tutorials, the live workouts, and the support to carry you all through it so that you don't need to worry about these things anymore. And obviously there's so much conflicting information out there. I've tried to address some of that today on the live with regards to the sitting, to help you at least understand why someone might recommend the knee hugs and the child's pose, but explaining why they're not ideal for the lumbar spine. That's what we help members with time and time again, asking questions. Oh, I saw this, what about that? I saw that. That's why we have a program with support, because people have questions as they go along. We've got a question, and later on, will I have to purchase equipment? If you want to do strengthening properly, you will need to either go to a gym or you will need some equipment at home. It's super simple, right? You could use water bottles, you could use a rucksack, you can really do a makeshift thing, but the point is, this isn't just a fad. Like the idea, the greatest success we can have with an individual that comes through the program is someone that goes, I didn't really pay much attention to my body before, but now I know that strength training is something that I'm going to do for the long term, and I'm going to invest in it in an appropriate manner, right? That's not paying us for that. That's you going out and saying, right, do you know what? I'm actually going to have a gym membership, or I'm actually going to have some equipment in my house that I purchase. And obviously everybody's got a different budget. Everybody's got different personal inclinations to invest in that and the space and the capability to do so. But you do need to make it a commitment to do that for the long term. Very, very important. Hopefully, that's one of the most important things I think out of this. Dejana said, what are your thoughts on Stuart McGill? I think Stuart McGill's got some really cool stuff, right? I think a lot of his stuff does align with ours. There are some points of contention. I've mentioned many times before about like the curl down, I think it's called, is exercise where you got your hand behind your back. I just don't understand why he didn't recommend using a towel instead of using the arm. It's not like a towel is a specialist piece of equipment, for the big three that is. And I think that it's missing some things, right? The big three, I don't want to speak out of turn, but I'm assuming that was something that like anyone with a back injury can do to improve their back strength, right? But the McGill Big Three is fundamentally missing one of the most essential components of back strength, and that is the actual load itself. And so that's a bit of a blind spot, I think. But definitely, Stuart McGill versus Mackenzie, those are the two big ones that a lot of people hear about. I think McGill stuff is way better than the Mackenzie. Mackenzie is just, I don't rate that at all. There's too many issues with it, right? It's just a shopping list of exercises, quite frankly. So hopefully that makes sense. Any other questions on that, you guys are welcome to. Anisan, are you answering the new questions and not the old ones? I have reposted my question over 10 times. Guys, this is TikTok on the live. We're trying to go through and answer as many questions as possible and go through all of these. Will the program help with determining where I am right now in my back recovery? That's one of the greatest things about the exercises themselves. It tells you exactly where you are in terms of the process of recovery, right? Because like I said earlier, and I know on TikTok there's lots of people that come in and then go out. So some of this is repetition for some of you guys that have been with us for a little bit longer on the live today. But like the exercises, for example, the squat is the test. It is the exercise. It is the driver of your progress, and it is the reevaluation tool. And it is the metric by which you can answer the question, how healed am I? How recovered am I? Because you know that if you can't even do a squat with a little bit of weight without losing your composure, you're very, very early on. But if you're able to do a squat now with 5, 10 kilos, but you know that 12 to 13 was actually too much, you know you're making improvement, but you're not quite there. And then you know that as you get to 30, 50, 60, 70 kilos, we had one of the members just posting last week, I was mentioning with you guys on the lives, that he's up to 80 kilos for 10 reps on the squat. You know you've built something, right? You know you've built something. That load is going through that spine, make no mistake, and you knew that it couldn't handle it before. And so there must be changes taking place in this disc. That's not to say if you take an MRI, it's all going to be back where it should be, so to speak. That's not how those things work. It's strengthening up, it's laying down scar tissue around this area, right? And then it's going to be remodeling that over a long period of time. But make no mistake, that is a probably the best, it's not perfect, but the best measure for how well you are doing. Aisha has said, I'm getting my first K laser for lower back tomorrow. Are there any side effects? The most important thing, so we do laser here, and like I've been using it for years. In our clinical practices, before we had our own clinic, and now, and I've got it in the other room. It's really, really cool. It really is. And I was doing that, so when I mentioned earlier, when I did my meniscus back in June, I was doing that 3 or 4 times a day, right? That week before the competition, and then the week after, and a couple of weeks after. I haven't done it in a little while now, because I've made so much progress with it, which is great, but it's really good. Like, it really is. It needs to be used over the target area. So if you've got an L5-S1 disc injury, so we're down here, we need to be over this area. If we're over here somewhere, or we're over here somewhere, we're not using it correctly, right? It has to be targeting the actual injury, but it's great stuff. It really is. It's not cheap either. How is strengthening in the back helping a disc bulge? So it's helping in a number of different ways, strengthening. Number one, when you're strengthening to start with, you're not actually strengthening, you are improving your technique, which means you are creating greater protection for disc bulge. You're learning how to coordinate yourself more effectively, creating a safer environment, less aggravations from a moment-to-moment basis. And then as you progress on, you're building more strength in the muscles, not the disc yet, around that area. So you're creating, again, still more protection for that injured disc. As you progress on further still, and we're adding a significant amount of load, we are actually remodeling the disc. Or rather, the disc is going through a healing process throughout that entire process that I just mentioned. But as we're adding load, it's directing those discs to know how strong they should be. And it is the stimulation that we get from our strength training, our load building, that is actually telling those discs how strong do they need to be. And one of the biggest problems or one of the big problems to consider with things like bed rest is when you are doing bed rest, the other discs in your spine are not getting daily stimulation. This is also one of the other things to consider, right? Like I mentioned earlier, I used to deadlift 230 something kilos. I cannot do that now. My discs will not be strong enough to be able to bear that load. They will have broken down. There's no need to maintain that kind of level of resilience. And so it's a plastic limit. And the idea is that your strength training now is driving that limit and telling the body through repeat exposure that without injury, that it needs to be this strong. And you're constantly pushing that barrier up over the long term, not over days and weeks, over months and years. That's the idea. And the idea is that you will be significantly better long before you reach that target. And we talk about 3 levels. Number 1 is going to be about 20% of your body weight. Figure out what that is as a target. Number 2 is about 45% of your body weight. And number 3 is, for ladies, 75%, for men, 100% of your body weight. And you should have those as little milestones that you want to pass on your squat and or your hip hinge over the long term, as demonstrations that these sections of your spine are actually going through a strengthening process. Oscar has said, I've been feeling a tingling in my lumbar spine. It's not painful and there is no shooting numbness. Is it a sign of healing? I'm not too sure, Oscar. I did see that question. I posted a little comment reply in the members area. A little bit more context would be super helpful, just so we can understand things a little bit better with regards to the tingling in the lower back and when it's happening, etc. Oscar also said, I did a hip hinge with 2 dumbbells. I feel aggravation is not a good idea to use. Yeah. Oscar, there's no need to use dumbbells. Like, I've seen you using the barbell. Stick to a barbell. No need whatsoever to use dumbbells anymore. Stick to the barbell when you're doing your squats and hip hinges. Now you've graduated to that kind of level. So definitely stick to using those. You're just changing the biomechanics and the pattern of movement. Like, a great example here. So today with bench, I've got 2 barbells in here. okay? I've got that barbell, that black one that kind of blends in with the post, and I've got a silver one over there. One is slightly larger than the other, right? I was doing my bench press today, picked the bar off, and I was using the black one. I don't normally use the black one for bench press, right? And I was like, this does not feel right. Like even that small change just affected my confidence on something that I'm doing like very, very, very comfortably, right? And when it was at max weight, like I was doing 120 kilos on the bench press, I was like, this feels like it was really, didn't like it. To the point where the whole way through the workout, I was like, should I just go back and get the other bar? Because the other bar is just down here, right? And I was like, you're being silly. But the idea of taking all the weight, I was like, God, I'm in a rush, I've got to get it done. And I didn't bother. But even that little thing, like when you're used to it, don't change things. There's no need to change the grips and randomly use dumbbells. I think that, like even, some of you guys will have had the experience when you travel, you go into a different gym and you're used to your gym. Like I always feel like those first workouts in an alien gym are just kind of rubbish because you're just trying to figure out what's what. And it requires a bit of time. Like, I like that machine. I use this weight on that machine. That machine feels like this. This setup uses this. These dumbbells feel like this, etc., etc. And you get used to it. Right? I used to hate those kind of dumbbells. These ones here, because they're really chunky, right? Especially once you start getting to like 20 kilos. They're just very chunky dumbbells. They're unnecessarily large for what they are. And but now, because I've been using them for a long time, like they're perfectly fine. I like them, right? And anything else, a different kind of shape, I wouldn't like as much. So, try and be consistent. That's the biggest thing with back pain, right? Irrespective of training, is consistency, control over variables. You don't want to give the idea of your training is that you've got super controlled, tight variables that you're just dialing one thing up or one thing down. Because there's enough variables out there in the real world, Oscar, in daily work, right? It could be something completely unrelated. Maybe you had a client coming in and you were helping them move stuff around a little bit more and you just lost a little bit of focus and that's what's causing it. Be hypercritical of your daily life, significantly more so than what you're doing, in the gym. We should still be critical of the gym, right? But if we're having altered sensations and those kind of changes, a little bit of irritation, always look to daily life. There's 16, 17, 18 hours of the day that you're awake doing stuff. That stuff needs to be, looked at for room for improvement, let's say. Very, very big, important. Also, definitely something to have a look at. See if you can optimize that in any way, shape, or form. Need pain or there, I said, my consultant says fusion is my only option now. I don't want to do that, but I don't want a lifetime of pain in my back and legs. I don't know the full circumstances there, but I would definitely recommend, if they're suggesting it's your only option, that means you've probably got a good window. And this is one of the big things we say to people that have surgery scheduled in advance. What you're saying is it's what is it now? It's the 13th of October today. Okay? If I've got surgery booked in or scheduled for after Christmas or in 2 or 3 months' time, the surgeon has effectively said, you're okay to go home and do stuff. Much of that stuff, they just say, take it easy, right? Very generic advice. Much of that stuff, if not all of it, will be significantly more provocative and more problematic for your spine than specific, targeted, focused, intent-driven rehab work, focusing on a neutral spine. And so we talked about this at length in the spine surgery podcast episode. You may as well start doing some of the rehab because by definition, they've sent you home with basically no guidance. So it's not an emergency surgery. We're not talking about that. And they have sent you home. So one of the scenarios to really play out here is do your rehab work prehab, because 2 things will happen. One of 2 things will happen. Number one, which I think in these kind of scenarios, judging by how poor the rehab education and guidance stuff often is that you've done leading up to this point, the most likely scenario is you get about a month or a couple of weeks out from surgery and you go, wait a second, I'm handling this a lot better. I didn't realize this was possible. I need to push back my surgery because I could go a bit further. And a good surgeon will be over the moon to hear that. Option number 2, you still end up having the surgery, but you have a much better time on the recovery side of things, rehab, because you've got your lessons out the way. When you're learning exercises for the first time, you make errors. If you've got those errors out the way before the surgery, you're not going to be making those errors after the surgery. And that's a massive boon to your prospects and prognosis, the other side of the operation if we do end up having it. So a couple things to think about there. What else have we got here, comments-wise? Hopefully that makes sense with the earlier question. How do you sit in a 14-hour flight with an L4-5 herniation? You don't sit the whole time. You try and get up, move around a little bit. I think the acknowledgement, we should be doing our rehab as best as we can, Becky, in those sorts of scenarios. But at the end of the day, there's so many aspects of that that are more problematic than the rehab. Because often, like, people say, you know, I can't do the exercise. Oh, but I've got a flight next week and I'm going 14 hours, right? It's not just the flight itself, it's the preparation for the travel. I would say, Becky, I don't know if you're going flying today or tomorrow, but send us a DM after this on TikTok and say, hey, Mike, can you send me a link to the travel podcast? Because we've got a number of things to kind of check off there. That'll be really helpful for you. Just send us a DM and ask us for that and we'll send you that afterwards. Are lower back raises good for sciatica? No. You want to focus on a neutral spine. Just doing extension of the lumbar spine is not ideal. You want to strengthen those muscles, but you do that through a hip hinge. You do that through a squat, fundamentally. What if an exercise causes irritation at the beginning of a workout, but after a set or two it doesn't? Often, Tito, that's because you're not quite as polished in those first few reps. Often. You're just kind of getting into your groove, and there are some technical errors. And that's where it's quite nice. If you, like, we see it all the time, right? People will upload their videos to the members area, and maybe, like, not all the time, but frequently, there'll be a couple of the first few reps look a bit clunky, right? And then boom, they get into the groove and they're feeling good and they're moving nicely. And so that's definitely something to look into there. Reflect on it. It should, with time, it should be that after you've gotten used to it and gotten better at it, you're not getting that variation in technique. But that's also because you're a beginner, right? You're just starting this stuff out. So you see so often where the person stands up and they're like, okay, do a squat, like loading squat program, okay, and then they go, right? And it may be a little bit rusty until they've done a few reps, okay? That's quite normal, quite common. Oscar, definitely give us some extra details in the members area, just so I can have a look at this and understand it a little bit better. But also have a look at what you've been doing on a daily basis, just so I can digest it in a little bit more, with a little bit more thought. Storyteller, what can I do instead of a hip hinge? Even most beginner level hip hinge gives me crazy sciatica. I don't even bend while hip hinging. So it's like, at what point, right? Okay, so you're standing here. Like, this is where videos make a big difference. Okay, you're standing here. Is that all you're doing? Like, is that what you can do? At what point, right? Because if you're doing a squat, for example, there's some element of hip hinge on the squat. So you're just not being refined enough. And this is where having, like, support is really, really quite important. If you go and upload a video to the members area, Storyteller, I don't know if you're a member or not. If you are, go and get a video uploaded and look at it. There will not be a day where you live life without a hip hinge. And so this is a really good, like, what can I do without bending forward? Like, you're doing it anyway every day. At some point, you go to put your trousers on, you put your underwear on, you put your socks on, you go to the bathroom, there is going to be an element of hip hinging by virtue of the fact that the leg got like this. That is a hip hinge. So you're doing it, you're just not very good at it. And so you need to learn it. And so, you know, that's where you've got to persevere. If you could get away with going through a day in your life without doing a hip hinge, then I would suggest, great, right? But this is why these exercises are chosen, because you can't, no one can, fundamentally go through a day without exposing themselves to these kind of movements. So you can either be, and they're so frequent, so you can either be good at it or you can continue to suck. And I think the second option is not appropriate. What else we got? Sam said, I'm uncomfortable with a lateral antalgic tilt when doing rehab. It feels as though I'm off balance. Unfortunately, a lot of people do have these tilts left and right. And the antalgic lean is quite common. And you just focus on trying to do it as square as you can. That's the best thing you can do. With time, you'll get better as you improve. It just takes time. What else have we got here? Good day. I had a spondylolisthesis at L5S1 for 1 year. In a lot of cases, guys, when you've got the spondylolisthesis, you've actually had it longer than a year. You know, it's just that you've strained the soft tissues in the last year to a point at which inflammation is built up, and now you're aware of it. I would argue a lot of the spondylolisthesis, you haven't been through a trauma that's significant enough to suggest that you had a sudden fracture of the lumbar spine, and it's caused a detachment of the front and back of the vertebra. The case history doesn't add up or support that hypothesis. It's much more a case of actually you've probably got that congenital defect at the pars, and the way in which we've been straining our body over time has caused a bit of shearing and a bit of that forward slippage. And then because of the forward slippages there, the structures are not as strong or as ergonomic as they would like to be. And so they become more strained more easily, and then inflammation builds up, and then you go and see someone, and it's like, yeah, the spondylolisthesis has been there for a long period of time. Your strength and resilience at that level has just been getting weaker and weaker and weaker, and you haven't been doing anything to build it up and strengthen it. And so rehab is so important. Building strength and resilience in the scenarios where we have the spondylolisthesis is so important for the long term. Focusing on a neutral spine is so important. Mankey has said, what exercises do you recommend specifying that neutral spine. We talk about the dead bug, the marching bridge, the squat, the hip hinge, the step up, and the single leg hip hinge. These are great exercises that will help you guys build a neutral spine. And guys, we're getting towards the end of the hour, so I'm going to start to round it off here a little bit. I'll try and get a couple more questions done. But guys, if you need any more help with this kind of stuff, definitely check out the link up here in the profile page for those of you guys on TikTok or if you're on YouTube. Check out the chat or the pinned comment for a link. Go and watch the video there that explains a little bit more about the program and get started. If you've been struggling, get started. Just get started. It's very, very simple. When you start, you go through the strategy material, which explains how to approach the exercises in the phase 1 of the program. And then you make progress doing the tutorial videos and you reflect it and you record what you're doing and then you build into the live workouts and you do the educational material and you make progress with a proper program rather than like a shopping list of exercises that you've kind of collated together or been given by the physio at your NHS appointment, right? It's much more robust than that. And you can get a little view of that on the video on that page. Storyteller said, you said if your pain increases after rehab exercises, you did it wrong. No, during rehab exercises, Many of you have pain every single day, have aggravation in the symptoms every single day, and you don't look clearly enough at your daily activities. So what happened is you'll finish the exercises, right? You finish the exercise, you got no aggravation during the exercise, it's fantastic, right? What did you do after, right? Probably the same stuff you've always been doing. And by the way, that same stuff has been there while you've had back pain before, right? Oh, I've gone and walked the dog. What does walking the dog involve? Oh, you know, carrying the lead, bending down, checking they're okay, all that kind of stuff, right? So you're doing all of those other things. Look at those other things. If you're getting aggravation later in the day, if you're getting aggravation during exercises, then you dig down, you look at the recordings of yourself. Are you doing it right or wrong? Storyteller said, would you recommend extending the back while hip hinging or neutral? No, everything is about neutral. We don't want to be extending the lumbar spine. We keep it neutral, very important. I'll just look to get a last couple of these in here, guys. What else have we got? Something good. Should I be doing back extensions on the Roman chair? No, I would not bother with back extensions on the Roman chair. I think you're just repeating a hip hinge. The Roman chair, one of the most important things for me, I had a question about, and I think I'll wrap it up here, guys. Hopefully this is going to be helpful for you. I had a question on TikTok about should I do good mornings, right? So good mornings where you got the bar on your back. I'm going to do it badly, but you got the bar on your back. Oh gosh, stiff after that workout. And then we're there and then we're coming over like so, right? What is that? It's a hip hinge, right? The question you should always ask yourself is what happens if I fail? What happens if I fail? And that's really the job of the person that's created the program, not you guys, but you guys should think about that because you're doing the doing, right? Let me just remind TikTok that I'm a human. Pull that across. There we go. So how do I fail is an important question. So if you're doing a good morning like that and you fail, it's just a hip hinge. It's just a hip hinge, but with the bar on your neck. Well, not on your neck, on your back, but I'm being a bit facetious, right? So you're just doing a hip hinge. Wouldn't it be safer if I hold the weight here? Because if I get to the point where I'm like, oh gosh, my technique's not that great. Oh, I messed up a little bit. I can just let go of the bar and it falls on the floor. If it's up here, I have to like fall over backwards and that's terrible. And the same thing with the Roman chair. The Roman chair is a hip hinge. It's another way to do exactly the same thing, except it's less relatable to the way in which you hip hinge in daily life. Because you don't get into a funny little chair on here and then do this, right, in daily life. Sure, it might be replicating you putting your baby to sleep, maybe, but it's a waste of time. Number one, it's something you have to buy that you didn't need to buy. Sure, it might not be that expensive, but then it comes to your house, it's metal, so it weighs a bit. You've now got to pick that up with a bad back and assemble it. Or you go into the gym and you find it and whatever, okay, fair enough. You then have to learn how to do it, and then you're locked in with your feet like so. I really need to just buy one of these, so I've stopped demonstrating it. I just feel like it'd be such a waste of money because I would never use it. But anyway. And then you're in the hip hinge position, right? With a brace on the front, your legs are locked in, you got the handlebars, right? These are for safety, so you can catch yourself. And then you have to get out when you hurt your back. So let's say you went too far on the Roman chair, right? And now you're in pain, which you shouldn't be, but it can happen to everybody and anybody at any time, right? We lost a bit of technique and we're in pain. We caught ourselves, great. Now I have to manage to somehow get out of this position. So I take one leg out, and it's just very, very awkward and completely and utterly unnecessary. Because if I was just doing a normal hip hinge, if I'm that nervous, I've got a chair in front of me. So if I go wrong, I can catch myself on the chair and I can push myself back up and I'm okay. If I'm using weight, I can just drop the weight, right? We have to think about what happens when things go wrong. Why do we recommend members do low hold dumbbells when we're doing the squats, when we're doing the hip hinges? Why? Because it means that if you fail, you can just let go. It's the safest environment in which to fail. The job of our rehab is to create an environment that has the lowest cost of failure. Significantly lower, by the way, than everything else you're doing every single day. Because it's actually thought through. You don't think about walking the dog and it chasing after a squirrel, but you do that in spite of the lower back pain. The amount of times people say, oh, we'll walk the dog in the morning, walk the dog in the evening. What happens if you pick up after them? What happens if they chased after a squirrel? What happens if they chase after another dog and you're attached to them? All these things have significant risk. And actually taking a step back to evaluate that, not to be fearful of doing anything in life, but to put the appropriate fear, or lack thereof, of your exercises in the appropriate place. Realizing that your exercises actually represent the 30 minutes to hour that is safest for your back of your entire living day. That is a realization that many of you guys need to come to, because the alternative viewpoint, that is not actually the case, that exercises are very scary and I couldn't possibly do them because I've got a bad back, by the way, is not a good place to be in, because it's factually incorrect. And you're willing to walk blindly into many of the risks and vulnerabilities that daily life would have you exposed to. So, hope that's been helpful for you guys. I'm gonna wrap it up there. We've been going for the hour. We'll probably be back tomorrow, so keep an eye out. This sort of time, I suspect. If you need help, need any more support, guys, check out the link up here in the profile page. If you've got any questions, you can send us a DM. Those of you on YouTube, guys, the link is in the chat. Sorry for those of you I didn't get around to the questions. We do our best. We will be back tomorrow. And again, if you guys need more support, check out the program. And those of you that joined that are members, if you need any more support, you know what to do in the members area, post your videos, all that kind of stuff. We're there to help you guys. Thanks for joining, guys. Thank you for all the questions. I mean that sincerely. And we'll see you back next time. Take care. And guys on YouTube, thank you for joining. And we'll see you guys next time as well.